ended up freelance writing, and that led me into the media. And then I spent 20 years as a journalist, most of that as an investigative reporter investigating our healthcare system. And so I'm a very morally minded person. I mean, that's kind of why I went into ministry. And then I find myself as a morally minded person entering our healthcare system,
Sure.
writing all my stories from the perspective of the patient and the person who's engaging in the care, trying to navigate this fractured, backwards, upside down healthcare system. And so I spoke to thousands of patients and experts, patients engaging with the system. For all the stories I did, hundreds of them, I would have the patient waive their HIPAA privacy rights. So I would get their medical records. I would talk to their doctors. I would talk to their hospitals. I would talk to their insurance companies. I was able to get at what was actually happening with these cases, right? I did a lot about the quality of care, and I did a lot about the cost of care. The last 10 years I was in journalism, I worked for ProPublica, which is probably the biggest investigative news organization in the country right now, based in New York City.
Sure.
And I recently just left ProPublica, and now my day job, I work for the Office of the Inspector General. So now, of all things, I work for the federal government, which is something I never thought would happen. But the OIG gives me the opportunity to do inspections and evaluations of how our taxpayer dollars are being spent on healthcare for Medicare, Medicaid, the CDC, the NIH, all these big programs. I always have to add the caveat that I am not here speaking as an OIG representative, right? This is not, I'm not here speaking for the government. Yes. I'm here talking personally as an author and educator. And then finally, I wrote the book, Never Pay the First Bill. And the subtitle of the book is Never Pay the First Bill and Other Ways to Fight the Healthcare System and Win. And I think the and win part might be the most important part of the whole title, because what I'm showing in the book is how individuals and employers can push back against this totally unfair, unjust healthcare system, overpriced, wasteful, exploiting people's sickness for profit. I'm showing in the book step by step. It's a manual about how to fight back and win. And when I say win, I'm talking about getting better healthcare benefits at a lower price. That is the win that I think the data supports that. And as you know, that's already happening around the country, where more informed and progressively minded health insurance advisors are teaming up with employers, and they're not doing things the same old way, right? You don't have to keep doing it the same way. And when they change, they're really unbundling. I mean, to simplify it, they're unbundling their health benefits package. They're changing the incentive structure. They're making it transparent. They're looking at the prices. They're reviewing the claims. They're getting out of these twisted, deceptive pharmacy benefit contracts. And they are finding ways to save 30, 40, even 50% for their employers, while the employer waives copays, waives deductibles, improves the benefits for the employees. I mean, what employee in America has been hearing at their annual enrollment meeting, hey, by the way, you got a reduction in your premium, we waived your deductible, and now instead of you wondering where you need to go for the highest quality care, we have a direct pay relationship with this orthopedic practice. I mean, it's amazing to see what's happening. And so I've independently documented all this as a journalist. I put it all in my book. And now the book has led to me launching my own company called Allen Health Academy. And my mission with Allen Health Academy is to make this idea of healthcare financial literacy and equipping employees part of every employer-sponsored health plan. I think that patient education is a huge missing component of bringing about success for these employer-sponsored health plans. And so the first thing I'm going to launch is a video curriculum that I'm calling the Never Pay Pathway. That'll be coming out in a couple months here. And that's based on the book. It's taking all of the how-to tactics and principles in the book and combining them into 16 short 3 to 5 minute videos so that an employee can go through the whole curriculum and they can learn how to avoid treatment they don't need, how to analyze a hospital bill to make sure it's accurate and fairly priced, how to even sue in small claims court to protect themselves if they're getting price gouged. These are things that, unfortunately, given the predatory nature of our healthcare system, employees need to know. And so I'm making it more accessible through these videos that will come out I'm hoping by the end of March or around that time.
Yeah,